Now, what are different types of stents which we can use in these patients of peripheral arterial disease? Now, we can have two types of stents. They can be self-expanding stents or they can be balloon expandable stents. So, you can have two types of stents, self-expanding or balloon expandable stents. Self-expanding stents are those which basically derive the expansion from mechanical spring-like actions. They have a mechanical spring-like action which is responsible for the expansion, and they are deployed by retracting a restraining sheath. Now, what are the common self-expanding stents? What are they made up of? The one very common self-expanding stent are the nitinol stents, nitinol is alloy made up of nickel and titanium. So, it's alloy made up of nickel and titanium. Then other type of self-expandable stents can be the alloy stents. Alloy stents are made up of cobalt with chromium and nickel. Cobalt, chromium, nickel, they are called as the alloy stents. Now, one important, so you can see this you can see are the self-expandable stents, So, this is basically a restraining sheath. So, when you retract the restraining sheath, the stent will be placed there and it's going to expand because of its spring-like action. It is going to expand and stay there in place. Now, these self-expanding stents, usually they have a long size. They are long in size, and because of that, they have a very important advantage is they can be used for stenting the long segment occlusions. They can be very useful for stenting of the long segment occlusions, and they are extremely ideal for internal carotid artery. For internal carotid artery lesions, they are considered ideal, these self-expandable stents. Then, apart from self-expanding stents, we have the balloon expandable stents. Balloon expandable stents, they are mounted on an angioplasty balloon, and they are they are mounted. You can see this is a balloon expandable stent mounted on angioplasty balloon, and they are deployed by the inflation of balloon. So, deployed with the inflation of balloon. What are they made up of? They are made up of stainless steel. So, these balloon expandable stents, they are made up of stainless steel. Now, balloon expandable stents, they are usually more rigid. They have limited flexibility, and usually that's why they're more ideal for short segment stenosis. So, they're more ideal for the short segment. The self-expanding one are more ideal for the long segment occlusions. These are more ideal for the short segment stenosis, the balloon expandable stents. And short segment stenosis or the lesions which are involving the ostia or the orifice. So, that's why they are very useful for proximal common iliac artery origin or the renal artery. So, they are very useful, very ideal for the proximal common iliac or the common iliac artery origin or the renal artery. Apart from this, we have certain drug-eluting stents also. Now, drug-eluting stents have been very successful, have been very useful in coronary artery disease. In coronary artery disease, they have a proven role. What are the drug-eluting stents? We have these nitinol stents which are bonded with an anti-inflammatory drug. So, these stents keep releasing this drug or the arterial wall, and they prevent the restenosis of the arterial wall. So, in coronary artery disease, they have a proven role, but now the studies are showing that they can be used and they are giving good results, good outcomes even in patients of the peripheral arterial diseases. So, that are different types of stents, important points which you should know about the stents. What are they made up of? Which one is used for a longer segment lesion? Which is used for a shorter segment lesion? What is a ideal vessel for these different type of stents?